My name is Dr. Calliope, and I am the neurologist who will be conducting your cranial nerve examination today. How you doing today? I see. Well, I hope by the time you leave my office, you feel even just the littlest bit better. Now, would you mind just telling me why it is you were referred to me to receive a cranial nerve examination? Mm-hmm. Okay, good to know. All right, let me just take a quick peek at what you've got going on here. So our cranial nerves, they govern things like our main senses, our ability to move our eyes. We have our hearing, our ability to swallow, the ability to make expressions with the face. So it's very important that these are healthy and intact. Okay. So there are 12 cranial nerves in total, but I'm going to be doing them a little out of order, as we are going to be doing a top-down approach. And that starts with the eyes. So let me grab a little light here, and we can look at the eyes. So we're going to start out very gentle, and I'm just going to hold the light underneath the eyes, just so I can get a good look. Do you mind if I get closer and start poking around a bit? Okay. So, on each eye, what we're looking for is we're looking at the health of the sclerae, the pupil, the iris, eyelashes, lacrimal gland, eyebrows here. We'll also look at the conjunctival tissue. But I want to make sure that these structures look normal. For example, that there are no signs of ptosis, that everything is midline and symmetrical. Okay, I'm going to have you move your eyes in different directions for me. So if I could have you just move your eyes up. Get a little bit of light here. Okay. Good. And can you just move them down? Can you move them to the side over here? And about over here. Good. Okay. Now I'm going to be lifting up one of your eyelids here. And if I could have you just look down. There we go. Good. And again, if I could have you look down. Good. I'm going to be pulling the eyelid down. If you could look up. Wonderful. And then, again, if you could just look up. Excellent. Very good. Now, we'll give your eyes a moment to reset. So I'm going to have you look at the Snellen chart behind me here. Okay? And that'll just get your eyes to reset a bit. And if you could look back at my nose. Okay. Keep looking at my nose. And I just want to check your pupillary response. Good. Just going to bring as in slow, and flick away, and slow away, slow away. We're looking how your eyes react to the light. Good. There we are. Good. Okay. Go ahead and look at the Snellen chart once more for me. For just a moment. And then right back here. Okay, so for our optic nerve, this nerve has a lot to do with our vision, our visual acuity, which we'll test with the Snellen chart, as well as our color vision, which we'll test with some Ishihara plates and some colored gels. So let's get you moved over, and we're going to test your ability to see the letters and numbers on our Snellen chart. So we're going to start right here at the biggest letter. Can you tell me what letter this is? Good, E. And what about right here? F. P. Excellent. Right here. T. O. Z. Good. L. B. E. D. Wonderful. And what about line 5 here, but backwards? D. F. C. E. P. Okay. E. D. F. C. Z. P. So from number 6, can you just come down here and read the last line that is clear to you? Good. Very good. Now if I could have you just cover one of your eyes, doesn't matter which one, just one of them. And if you could read this line backwards. D, E, B, L, good. And down to 6. D, F, C, Z, P. And how about down to 8 here? D, E, F, B, O, D, E, C. Good. And can you read number 10 here? F, D, L, T, C, E, O. Can you cover the other eye then, please? Good. Can you read line 5 backwards? D, F, C, E, P. Good. And line 10, or 7 rather, line 7, forwards. F, E, L, O, B, C, D. And what about line 9 here? L, E, F, O, D, F, C. And line 10 backwards. Now you can uncover both eyes. And can you just read me the line of fractions starting right here? 20 over 200, 20 over 140, 20 over 100, 20 over 70, 50, 20 over 30, 20 over 25, 2020, and 2010. Excellent. So let's move on to our other optic nerve tests. Now I have a little booklet here. I have a little booklet that contains some color plates, and these are designed specifically to test for different kinds of color blindness. So this is our control plate. Can you tell me what number you see in the middle of this plate? Good. So we're going to flip through this a bit. I'm going to ask you to tell me what numbers you see on the plates. Like these, for example. What numbers do you see here? Good. And what about these right here? What numbers do we see here? Good. And these ones? Right here? Good. What about these? Very good. And the numbers in these plates? Perfect. There are no numbers there. And these? Good. And these? What numbers are in these plates? Very good. Now I have some colored gels, and these are little plastic filters that are in quite a few different colors. And I want you to tell me what color it is you see when I put the gel over your eyes. You could just tell me what color you see. What color did this gel make everything? Perfect. And what about this one? This one. color does this gel make everything? Good. What color do you see? Yes. What color do you see? What color do you see? Last one. What color do you see here? Good. Very good. Now, we are going to move to our other cranial nerves of the eye after we take a little peek at the back of your eye. This tool here called an ophthalmoscope. And this has a light that comes right through here. I have a little magnifying glass with a dial, and I can see your optic nerve at the back of your eye using this. So, I'm going to have you just stay as still as possible, and I'm going to try to get there we are, red light reflex, and look around at the back of your eye. There we are, so we can look at the blood vessels, the macula, the optic disc, the retina. We can just check to make sure everything looks okay here. Good. Nice and easy. So, again, go ahead, just keep still for me. There we are. Okay. And just checking. Get a little closer. Just checking. So we have our optic disc there. We have the retina at the back. Blood vessels coming out. Also good. Macula there. Excellent. Excellent. Oh, that's the only cranial nerve we can get a look at ourselves, just in a normal clinical setting. So we have 3 more nerves that connect to the eye here, and they govern eye movement. They control the little muscles that allow your eyes to move up, down, each side, and even in each diagonal direction. So let me just grab this right here. So this little ophthalmoscope. I'm going to have you focus your eyes right here, and I'm going to have you follow the ophthalmoscope using only your eyes without moving your head. Alright? Okay, so let's try our diagonals first. And just see if you can move your eyes each way without issue. Very good. Good. Okay, and how about side to side here? to the side. Is there any issue at all with moving your eyes from side to side? Okay, how about up and down, up and down. Wonderful. Okay, and there's no lid lag there. And can you just keep your eyes focused here? I'm going to bring the ophthalmoscope in and out. In and out. Good. In and out. In and out. Okay. Can you focus on this right here? Now can you look at the Snellen chart? Good. And the ophthalmoscope. And the painting in the background here. The ophthalmoscope. My finger over here. Keep following my finger in. Very good. Okay. Now, I am going to have you not track, but instead move your eyes of your own accord. So if I could just have you look up, and I'm going to look at your eyes. As I do so, look down. Good. Over here. Over here. Good. How about down here? And right here. Here. And right here. Very good. Can you look right at my nose here? And you will be seeing my fingers come in your periphery. I just want you to tell me when you see the fingers. You can just say yes. Great. Okay. Good. 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 Perfect. Yes. Good. Good. Yes. Yes. Excellent. Okay. So now I am going to have you just cover one eye here. And I'm going to have you follow my fingers around. And we're going to check each eye individually. So keep this eye covered. And just follow my fingers. And these are going to go in a pretty easy, simple little H shape. Good. Up and down. Up. Good. And if you could just cover the other eye here. There you are. So go to the sides a few times. Good. And the side a few times. Over here. Good. And in the middle. Up and down. Up go ahead and uncover your eyes there. So I have a few scents for you to try to identify. So we are moving from the eyes to the nose. So we'll be testing the olfactory nerve, cranial nerve number 1. And since we're getting closer to the winter holidays, we have a little theme going here. So, very first smell here. If you could tell me what this smells like. Good, that is ginger. Okay, and if I could have you just occlude one side of the nose, right there. Good. What is this smell? Good. It's another warm spice. That one is nutmeg. Now let's try a more savory one. So keep that nostril occluded. Tell me what this smells like. Pretty easy, yeah. Quite strong as well. That would be garlic. Back to sweet. I could just have you occlude the other nostril. Okay. What does this smell like? Cinnamon. Wonderful. And lastly, we'll finish with a savory scent. What does this smell? Very good. That is sage. Okay. Let's put those back. You can go ahead and uncover your nose. So cranial nerve 1, rather, is intact. And then we can move from the eyes, the nose, and now to the ears. I have a few objects. Again, we're going with a seasonal vibe here. A few objects that we're going to use for testing your hearing with the vestibulocochlear nerve. So, I have a couple objects here. One side and the other. I want you to tell me whether you hear the sound on the left side or the right side. All right. Okay. Left or right? Mm-hmm. Good. Yes. Good. Mm-hmm. Yes. Good. Mm-hmm. Good. Mm-hmm. Good. Yes. Good. There are little jingle bells there. And now another object here. Again, if you could just tell me left or right. Hmm? Good. Yes. Good. Mm-hmm. Good. Mm-hmm. Very good. There are a couple of handmade ornaments that my partner and I have been making. We've just got a little base coat on them right now. We decided to make a whole new set for our tree this year. Now, last sound. Let me just get this ready. Okay. Again, tell me if you hear the sound on the left or the right. Good. Mm-hmm. Yes. Good. Mm-hmm. Good. Mm-hmm. Good. Mm-hmm. Yes. And that would be a pretty crunchy, scratchy gold ribbon for gift wrapping. There we are. So now let me just get my tongue depressor here and my light. And we're going to check the glossopharyngeal and vagus nerves now. I'm going to have you open your mouth here. There we are. Just stick your tongue out as far as it'll go. Okay, and I'm going to press the tongue down further. And now I'm just going to have you say, ah. That way you can look at the uvula. Perfect. And then if I could have you take a dry swallow. Seems easy. It's a little more tricky. Just a quick dry swallow. Okay. Was there any difficulty with that at all? No, so no dysphagia there. Excellent. So let's look at the hypoglossal nerve, which governs your tongue movement. There's a whole nerve dedicated to just your tongue. You could stick out your tongue again. Okay, can you move it this way? And this way. Good, can you move it up? Good, and down. And can you stick your tongue to the roof of your mouth? Very good. Now I'm going to ask you to push your tongue into the pocket of your cheek, like so. And I'm going to try to push it in, and I want you to resist me. Just like that, okay? So if you could stick your tongue into this cheek, I'm going to try to push it in. I want you to resist me here. Good. And the other cheek. There. Just resist me here. Very good. Now let's move on to the trigeminal nerve. I'm going to need a little brush here. So for the trigeminal nerve, this governs both a sensory aspect and a motor aspect. We have facial sensation as well as chewing. So we're going to start with sensation, and I'm going to use this brush. We're going to test the soft side and the dull side. So I'm going to ask you if you feel a soft touch or a dull touch. All right? This is what it feels like. This is soft. And this is dull. Okay? So just tell me whether you feel a soft or a dull touch. Soft. Dull. Soft. Dull. 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 Soft. Soft. Good. Soft. Dull. Soft. Dull. Soft. Soft. Dull. Soft. Dull. Soft. Dull. And soft. Very good. So, for the motor aspect, all I'm going to have you do here to start is if you could just clench the jaw and unclench the jaw. Good. Clench the jaw. Unclench. Clench. Unclench. Okay. I'm going to have you move the jaw in different ways now. So I could have you, if I could have you move the jaw to this side. I'm going to try to press it back to midline. I want you to resist me here. Good. And the other side here. And I'm going to try to press it back. You could just resist me. Good. Keep the jaw closed. I'm going to try to pull the jaw open by pulling on the chin. Please resist me. we have good strength and movement in the jaw here. So we have a couple last nerves. Our facial nerve is our facial expression nerve. So I'm going to have you raise the eyebrows. Good. Can you scrunch up your forehead? Good. Close your eyes real tight. Okay. Close your eyes tight and I'm going to try to open them. I want you to resist me. Resist me opening them. The other side. Good. If you could open your eyes real wide, make some crazy eyes. Good. Can you smile real big? Can you smile with just your mouth? And can you frown? Excellent. And can you puff out your cheeks? Wonderful. Can you keep them puffed out? And I'm going to try to press in on them. I want you to resist me pressing in. Like that. Okay, keep them puffed out. Very good. Okay. Now, our last nerve is the accessory nerve. So I am going to have you do some different range of movement tests. If I could have you bring your head back and forward. Turn to the side. And the other side. Tilt the head laterally. And the other way. Good. Can you bring your head back and I'm going to try to pull it forward. I want you to resist me here. Good. And can you bring your head forward? I'm going to try to push it back. I want you to resist me. Good. Can you turn your head here? I'm going to try to bring it back to midline. I want you to resist me. Good. And the other side. Good. Tilt your head. I'm going to try to bring it back up. Good. And the other side. Excellent. Last little accessory test here. Can you shrug your shoulders? Yep, fairly easy there. Good, we've got good bilateral movement. I'm going to push down on your shoulders. I want you to shrug up against me. I'm pushing down. If you could shrug up. Good. And if you could keep your shoulders up, I'm going to try to press them down. I want you to resist me. Good. Good power there. So you can relax the shoulders. And let's see what we've got here. So we did our Snellen chart test, as well as testing color vision with the Ishihara plates and the gels. We did our little fundoscopy. We tested your eye movement and peripheral vision. Smell test. Vestibulocochlear nerve. 9 and 10. Hypoglossal. We did the soft dull sensation tests. And we did the motor tests for the jaw. Tested the facial expressions. And we checked head range of movement and strength. So that looks like we have completed our cranial nerve examination. Do you have any questions for me at all? Yes, so for your referral, so we have ruled out any interference from the cranial nerves in terms of what I was seeing you for. So we've unfortunately not found the cause, but we have ruled out any interaction with the cranial nerves. There we are. Okay. All right. I'd like to thank you so much for joining me for this cranial nerve examination. I hope you have a whale of a day and a good rest of your night. Thank you.